For the United States in particular, we have very bad statistics. We don't keep good numbers. And so the problem is we don't know what the number of abortions that are done even in our country because we don't collect them all because it's voluntary. And two, we don't know how many of the patients have complications because we don't keep track of that either. That's not mandatory, and they're poorly reported. If you look at other nations, in particular Finland or Sweden or Denmark, they have a much better system where they record all incidents of medical care. And so they're much better at recording complications and mortality rates than we are.
In the United States, there's also a conflict of interest. And this was also true with the smoking issue. You didn't find any of the cigarette makers going around collecting statistics on what the health problems that the smoking was incurring. And similarly, the people who have access to the data in terms of post-induced abortion complications are the very ones who are doing the abortions, and they're getting paid money to do this.
The tobacco companies, which are huge, multi-billion-dollar companies, were frantically trying to cover up any evidence that there's anything wrong with tobacco smoking.
But then over time, the case for causality in terms of tobacco use and lung cancer and other forms of cancer was built over time with studies that were as controlled as possible. And the same is true with the research on the psychological effects of abortion.
That's right. They're not gathering them and they don't report them. Their studies which have been done tend to be retrospective, and so they get complicated by the fact that the women don't admit that they've had an abortion.
A meta-analysis is a quantitative review of the literature. When you conduct a meta-analysis, you're not collecting new data. What you're doing is you're putting together data in a systematic way from already published studies. And so it's a way to look at the larger effect of some things.
And so on the outside, it looks like abortions are safer than childbirth. The reality is, if you look at the long-term complications of induced abortions and you start looking at the self-abuse rates which lead to addictions, which lead to suicide, and you take into account the number of people who've had an induced abortion, who did not have a mental health problem beforehand, who develop a mental health problem and then go on to suicide or become involved in a violent death, which is accidental, or a violent death, i.e. a homicide, that's much higher than the general population, increases by about 6-fold. So take those deaths into account, there's no way that abortion is safer than childbirth.
If you look at just depression alone, childbirth is a healthier option. You're more likely to experience a significant depressive episode after an abortion.
There is a difference between what's reported in terms of post-abortion complications in the United States and what's reported in the rest of the world literature. The British Society of Obstetricians and Gynecologists, in their 2003 guidelines report, which was put out to physicians as guidelines for managing induced abortions, state an 11% complication rate. The same sort of guidelines which were put out by the American Society of Obstetricians and Gynecologists report a rate between 1.5 and 3%. Why? It's probably a lot to do with the way that people gather statistics. And in the States, the majority of the abortions are done in private clinics. The follow-up, which is done again in a private healthcare system, so that the connection between the induced abortion and the follow-up problem, be it pelvic inflammatory disease, hemorrhage, depression, suicide, wouldn't be caught. Whereas in Canada and also in Europe, because they're publicly funded healthcare systems, the data gathering is much, much better. And so the linkage can be made between the two. So I think it's a difference in terms of how you gather your data. And there's always that quote, right? There's lies, damn lies, and then there's statistics. And when you quote statistics from the States and you quote statistics from Europe, and there's a wide divergence, you just have to ask yourself what they're doing with the statistics.
Yeah, I think the problem is that it's become so politicized and so polarizing that people are afraid to engage the data truthfully and accurately. And so we can't get people to actually sit down and just look at the data, what actually does happen. And it's clear that abortion is not without effects emotionally and psychologically on women.
We're actually like the ostrich. We keep our head in the sand and we ignore the post-op complications of induced abortions to the detriment of the health and the well-being of women.